Last week, we told you about a new program in Oakland County that aims to help residents erase medical debt. Today, we're diving deeper into the program and how it could help thousands of residents. Board Chair of Oakland County Board of Commissioners, David Woodward, is here to explain more. Thank you so much for being here, David.
Thanks for having me.
So how did this program get started, and who are you working with to make it happen?
The idea, one of our colleagues on the board, looking for ways to lower the cost of living for residents on a regular basis. RIP Medical Debt is a national nonprofit working to negotiate with the debt collectors of medical debt. When we realize that for pennies on the dollar that we can buy up this medical debt and in essence like leverage $200 million of medical debt that we can wipe off the backs of workers across Oakland County, it was a no-brainer.
$200 million.
Yeah.
Talk about impact.
It's huge. I mean, medical debt is one of those leading causes of bankruptcy. It makes it harder sometimes to get a job because it lands on your credit. Harder to get a mortgage, makes your car payment more expensive. It really chokes your ability to kind of get on your feet. And no one goes out shopping beyond their means for medical care. You had an emergency surgery, you had a very high deductible and don't have the money to pay for it. These are things that get in the way of people being able to succeed. And so by erasing this debt, it's a reset. Part of the program also requires that it to be the hospitals to agree to remove it off the credit histories of individuals so we can get people a fresh start so that they can be able to take advantage of better credit scores and then what that translates into life and lowering the cost of living.
And where is this money coming from?
Thanks to President Joe Biden and the American Rescue Plan, Oakland County was fortunate to receive a significant amount of resources. We are using a portion of those monies. The state of Michigan also allocated millions of dollars towards this program statewide, and we're hoping to leverage on that to be able to extend this benefit and wipe the debt, a medical debt of tens of thousands more people as a result of it.
So who qualifies for this program?
Generally, the people with medical debt. If you, qualified and had healthcare Medicaid services, that you didn't really incur medical debt. It's that 200, 300, 400% above poverty level. Really trying to get to working class families where this can make the biggest benefit. And like I said, these are generally people who, if they had insurance, had very high deductibles, and that medical procedure popped out of nowhere. These are individuals that this small amount of money that we're able to put forward, pennies on the dollar, can wipe out the debt, reset the clock, and allow people to be able to take benefit of better credit and rebuilding their financial prosperity.
So do you think other counties will follow in your footsteps? This is major.
This is big, and we're the first major county in Michigan to be able to do that. I do actually believe that some of our surrounding counties are going to adopt this. The state of Michigan recognizes this is very important and is looking at how to do this and support it across the state. I think all together, potentially millions of families benefiting as a result of this. And we've seen great success in other areas around the country, to the Toledo area, Hamilton County, and I think Oakland County being the first major county to do this, just shows that we're committed to helping working families get ahead, taking these federal resources that are made possible because of the President and Congress, and really making long-term benefit to improving the lives of working families here in Michigan.
And how can Oakland County residents apply?
The programs are going to really launch next year, so we've got some of the final legal work that we have to negotiate with the contract. We approved just last week the money to go into this program, and so I would expect, people stay tuned, sign up for the alerts of the Oakland County website, and more information will be there. But I would imagine next year, basically put yourself in there, you qualify, the participating hospitals, the information will be collected, and then we can really start saving and wiping out this medical debt and tens of thousands of people across Oakland County.
Yes, and beyond the debt, I've always felt maybe it also creates that bridge and gap and barrier of care because you don't want to acquire more debt. So people just don't seek out care at all.
Absolutely. And like I said, no one is living beyond their means seeking out health care. These are instances that happen, largely unfortunate instances that you need medical care. People need to get medical care. We have the ability to make people well, healthier, etc. We want people to seek those services. The inability to pay and then it collapses on your entire life is a real problem. And this is one way that we can improve people's lives. And so we're proud to lead in Michigan, and we welcome all our other counties to learn from our experience and hopefully replicate.
Well, David, thanks so much for being here to tell us all about it.
Great. Well, thank you very much for having me.
Thank you.